Hi, I'm Christine Bowen, and I am taking a clinical supervising class for Aspen University, and this video is going to be a mock interview between a clinical supervisor and the supervisee, and it's going to be a review on a previous session with the supervisee and a client. So what experiences have you had this week?
Well, I have a client that's struggling with depression.
What's the struggle?
Her biggest problem she faces right now is that her husband hasn't been able to find full-time work. And so I'm unsure how to help the client feel better about the situation and be supportive of her husband.
Right. So what have you suggested the client do so far?
Being patient and helping where they can without enabling him.
Well, that's a good response. You for sure don't want the client to be in a situation they can't control, but you also want them to remain supportive of, their significant other. If she's unable to help the husband and is the only one trying to get him a job, she's eventually going to feel like it's her fault.
I know it's not her fault, and she knows it's not her fault.
She may know it right now, but that could be a problem for the future. If she does not think it's her fault, then she could possibly blame her husband, for different reasons like failing interviews or work ethic, and obviously that's going to cause a potential problem in their relationship.
Well, that's true. I'll remind her that helping and supporting her husband is a brave and strong thing to do, and that the outcome is out of her control. If it becomes too much, she needs to try and remind herself that this is not her husband's control either.
Perfect. I think a great way to eliminate the idea that either of them are causing a problem and emphasizing the situation is out of their control. And we can continue to talk about that in our next little meetup. See where you're at with it and what kind of suggestions you've made in the next session with your client.
Okay.
And just to reflect on our session that we had, the ability to read people is very important in recognizing the parallel process. The situation may not be exact, but if a supervisee is paralleling a client's emotions of depression or sadness, that should definitely be addressed in a supervisee-supervisor meeting. And the approach that, and the supervisor should also be cautious not to cross any boundaries when discussing the situation with the supervisee. And the approach that I, as the supervisor, used was more of an indirect focus on the client and the supervisee's relationship, in order to not rupture the alliance that they have. The indirect intervention that they had did address tasks that should be completed, but a direct intervention would have clarified the need for the intervention and any other misunderstandings. Two different styles to follow for the evaluation process within supervisor inventory are goal setting and feedback. So thank you for watching.